Together, we're stronger than cancer. Together, we're
Together, we're stronger than cancer.
I was diagnosed by accident, in a way, with a pre-stage of breast cancer. And I was thinking, this is not happening because I feel good, I don't have anything. It was a routine checkup. And then all of a sudden you're a patient. And I was supported very well. I had good treatment because I was privileged that I was born in the Netherlands, where there is a lot of good care, where there is a complete network of things that can be done. I realize it's not everywhere the same for everybody. And then when I came back here, after all my treatments, I decided to tell my story, to share with people that it's okay. I mean, when you get this, it's part of life. You don't have to be ashamed of it. There's nothing you can do about it. But speak up and make sure that you get the best treatment. One of the inspirations is that you see NGOs and others trying to help. And this is volunteers. I think that's already very inspiring. The other thing is, I think we all know people who are confronted with cancer. I'm afraid we all know people who didn't make it, and people who are ill. So I think that's already a big source of inspiration. And then I decided to think about a way to add my voice and that of my female ambassadors here in Rwanda to the other efforts that are already there. Because I think awareness is a big thing and we don't yet have enough of that. Like you could see, there was a school with 92 girls. It's amazing. You can reach people and they will talk to others. And like that you can amplify the message.
I think people are still not aware how simple it is to run a simple exam for early detection of breast cancer, and the difference between early detection and late. And the reason why there's a whole month of raising awareness to breast cancer and this walk, and it's a global movement, is because sometimes people are just not aware. So the first thing is to really raise awareness. Simple today, especially in Rwanda, with how much it's progressed and how much you've done in the field of health and public service, there is really a lot of many ways to do this exam. So first we raise awareness, just go and check. And the second thing, the walk is a movement of unity. You see women and you see men, because again, people are not aware that there is breast cancer, it prevails also in men. And what the third element is that breast cancer is the fastest growing cancer, almost one of the fastest growing cancers in the world. And if it used to be 1 in 9 women, now the numbers are even higher. And I think we do it because we are a community. And it's also important to say that Rwanda is a spearhead when it comes to health, and is doing so many things for the continent. And I think if the voice comes from this country, we don't only touch Rwandans, we touch the EAC and the continent.
Cancer is everywhere. Cancer, I think every family now is complaining about cancer. So it's a kind of awareness that people should understand that cancer is within our families. We have to do something. So we are expecting that this knowledge goes to many people, that also they can go for screening. And I used to tell people, this is not cancer for women, cancer is also for men. But also men has to support women. If you find there is a swelling, one is complaining, I'm having swelling, I'm having pain, don't wait. go to the screening area and see if you have cancer.
Rwanda is the country with the highest percentage of people with insurance. This is a tremendous achievement. I keep saying that I'm half ambassador for Rwanda because I'm very proud of this country. If you have insurance, it's very easy to go to the doctor and just do its tests. My message to anyone who has just heard that he or she has cancer, breast cancer, other cancer, is to consult. Don't keep, Rwandans sometimes have the tendency to keep feelings inside. This is the worst. You have to unbottle it and talk. And it's a country with a community. So use the immediate community and your family. Take professional consultants. Talk. And the second thing is, of course, there's many ways these days more progressed to try and fight it. You're not alone in that. That's the most important thing to say.
Well, maybe my message to people is get screened, learn how to do it yourself, because that's, for breast cancer, that's a very big thing. And when you get diagnosed, don't sit in the corner and be scared, but go out there, fight for yourself, get treatment, ask many questions about what you need, what can be done, and organize people around you who can support you. Yeah, that is actually what can come out of this is actually very simple. I'm hoping for more awareness, for more acceptance, and also more recognition for the NGOs that are doing the fantastic work, like the Betania Home Care, like the Rwanda Cancer Relief. We are hoping to get donations for them as well today. Can be small, doesn't matter, anything you can spare. But those are the things why we do this. More awareness and more support for people who do fantastic work, mainly as volunteers as well.